Lovely Vet. I'm Dr. Jenna Shivers and this is Mindy Moo. Thank you so much for tuning into our video. Today we're featuring information on hotspots for our dogs. So just wanting to get started by saying thank you so much again for coming out. Feel free to subscribe to our channel. We do make new videos every Thursday. We've just put timestamps in all of our videos because we value your time. You can jump through from one section to the next as needed. They each have little titles so you can see exactly where you want to go and whether you want to rewatch just a certain clip. And if you're looking for daily tips and tricks, feel free to follow us on Instagram at The Lovely Vet. And we post up new tips and tricks for each subject that we do each week, as well as some simple tutorial videos as well. Just to start, what are hotspots? So hotspots on dogs are generally kind of weeping, crusting lesions on the skin that you can see. Oftentimes they're like a patch of hair that looks like it's kind of thick with a little bit of like gooey kind of substance, and it's usually pretty stinky. It'll start off really small and then they grow extremely quickly. If you do note that starting on your dog, getting them assessed as soon as possible is extremely important. On our dogs they're caused by swimming, oftentimes we'll see them on parts of hair that are really thick and dense and don't dry very well. Oftentimes it's the long hair in and around under the ears, on the neck, especially if there's neck folds, sometimes in the armpits, sometimes on the belly or groin. The most common breeds that we see hotspots in. So the majority of dogs that we see hotspots are usually those dogs with really dense coats who love to swim, and it's usually in the summertime. So oftentimes it's caused by wetting of the skin that kind of stays wet and becomes itchy and infected. So our number one breed are beautiful Goldens. Number two, close second, would be our long-haired Shepherds, Bernese Mountain Dogs, St. Bernards, especially because they do have extra hair and kind of folds and flaps kind of under their neck and under their ears because they're kind of a droopy dog. Next are our Poodle crosses or our Doodle breeds, mostly because they're crossed with our Goldens or because they haven't been groomed well for the summer. So with your Doodles, you want to keep them quite short in the summertime if they are going to be in the water quite a bit, and make sure that they're not matted in any places. And then finally, even though they don't have long, dense hair, English Bulldogs are a culprit, mostly because they are a high risk for skin allergies, as well as they have lots of little folds that can stay moist and get infected. Next up, we're going to be going through some tips on how to avoid hot spots, and then we'll get into the treatment of it. So making sure your dog is toweled off and dry after they're done swimming. If your dog is frequent in the water and does get hot spots, checking them over once daily to make sure they don't have any little pinpoint lesions or kind of loony or toony sized lesions if you're in Canada. And because they will grow very quickly. Oftentimes, hotspots are associated with other infections. So the big one we see is ear infections. Also with the back end, the dogs that get anal gland infections or anal gland impactions tend to lick at the back end, and they can get open or itch at the back end. They can get open moist dermatitis or hot spots there as well. And then itchiness, general seasonal allergies, food allergies, anything that causes your dog to itch can potentially open up the skin and cause those hot spots. In our senior pets, we tend to see those lesions around the wrist area, elbows, hips, and that's likely due to pain in those joints. So definitely addressing that with your veterinarian, making sure they have a treatment plan to keep them as comfortable and pain-free as possible during their senior years. Making sure you're brushing, bathing, and grooming appropriately for the season. We talked already about doing some seasonal grooming and making sure that your dog has the appropriate length hair for the season and for the breed. Most dogs that shed, there's a suggestion not to have them shave down for the summer. However, if they're the type of dog that loves the water, always wants to be in there, we want them to enjoy their summer. And I would say most vets and groomers would agree. If that is your dog, having them shave down for the summer is warranted. Next, we're going to hand it over to Jaycee Elliot. She has been a professional groomer for over 20 years and also working in the emergency vet field for over 20 years. She is a wonderful groomer. She has her own business called Picture Perfect Pet Grooming, and she does a wonderful job. Please check out her page. She's got tons of experience and is certainly loves to take care of our pets when they need a fluffy updo or when they have a medical need to get them shaved down. Take it away, Jaycee.
Hey, I'm Jaycee. I'm a professional pet groomer. I also work in emergency veterinary medicine, and this is Charlie. So we've talked about what we can do from a medical aspect of hotspots, but what can we do from a cosmetic aspect? We could go shorter. There's different ways to make your pet's coat shorter. You can remove the undercoat and leave the outer coat. Sometimes hard to do. You can clipper comb them, you can hand scissor them, or you can just remove it completely. This can be controversial. Does it wreck their coat? If your pet doesn't have an underlying thyroid condition or medical condition, it usually grows in softer without that dense SOS pad, spongy-like substance, which is the cause of most hotspots. Do people like it? I've had a lot of clients hem and haw and are worried about it, but every summer they come back, they make their golden retriever look like a lab, and they enjoy the summer with their pet. So my suggestion would be, if you don't want to spend all the time drying and shamming your pet off, just go shorter. It'll grow back. It's hair. And then you can just chamois your pet off and have summer fun. Right, Charlie?
Okay, getting into treatment. This is the juicy details that I think everyone's been waiting for. Things to get ready before you start your hotspot treatment. Number one, get your clippers with a short blade. I recommend using a 40 blade to get right down to the skin. Number two, gauze squares and your chlorhexidine shampoo or soap. Number three, Epsom salt solution. We'll go through how to make that in just a moment, as well as your gauze squares or clean cloth to soak that area.
And of course, as always, don't forget the treats.
To make an Epsom salt solution, so number one, we're going to start by shaving the area. We're going to get our clipper blades appropriately clean, sharp clipper blades. We're going to shave the whole area around the hot spot, including out to the edges where we can see normal skin. This is very important. If we don't go that far, the lesion will continue to spread. We want the air to get at the area to help dry everything out. The next step is to use your chlorhexidine soap or your chlorhexidine shampoo and scrub the area, get rid of all of that sticky debris. You can pat that dry, and then our plan going forward is to do Epsom salt soaks. So, and then we're going to take our warm cloth or gauze squares, and we're going to soak that in there. We're then going to apply that to the hot spot and hold on there for 10 to 15 minutes, 2 to 3 times a day. And we're going to continue to do this until the hot spot is completely cleared up. This is one of the most important parts. I want to warn you, please do not apply anything to the hot spot. The air getting at it is really important to heal it. Unless your veterinarian has specifically given you something to put on it, please do not apply anything from over the counter. And finally, these spots are super itchy and the dog is going to be super irritated. We really do need to get out our cone of shame, unfortunately. The cone is going to avoid them from scratching the hot spot area under their neck. It'll avoid them from turning around and licking or scratching kind of the groin area, the back end, etc. You can use a little sock if it's specifically on like a wrist or a paw, just being warned that some dogs will eat socks. So just be cautious with that. If that's your type of dog that likes to eat things, do not use a sock, please. The cone of shame will be sufficient. You have to make sure the cone of shame comes out at least 2 inches past their nose, because a lot of dogs can reach their neck out, push it back, and still get to long places. Unless it's right on their cheeks, you only really need a cone long enough to cover that so they can't scratch with their back legs. Finally, I wanted to touch on when it's important to take your dog into the vet clinic. So some dogs, especially if the hotspot has been happening for some time, can get very ill from them. And certain breeds get more sick than others, I find, potentially just because Goldens are overrepresented with hotspots. I do find some Goldens can get quite sick with hotspots. If your dog stops eating or is not interested in drinking or is very lethargic, please bring them into the vet clinic as soon as possible. If they start having any vomiting or diarrhea, again, get them into the vet clinic as soon as possible. If it's a long weekend or something, take them to the emergency clinic because they're not going to get any better without some more serious treatment. If your dog is very painful, or you think this hot spots are getting worse even though you've tried to clip them up, or if you're unable to actually shave the spots appropriately because the dog is too painful. Some dogs will require a full sedation and pain control even just to get at shaving those hot spots. So please be cautious. If your dog is extremely upset and painful, please avoid doing that. And if your dog will not stop itching or scratching, obviously we need to get them in and get some more treatment. Sometimes the infection can spread where the point of an oral antibiotic or an oral steroid or topical antibiotic or steroid is necessary, and your veterinarian can determine that. So please get assessed by your veterinarian as soon as possible if your dog is sick, on top of having those lesions as well. I wanted to say thank you again so much to our guest Jaycee Elliot for featuring our dog grooming video. Thanks so much for checking out this hotspot video. Please feel free to like, subscribe, and share with friends if you find this information is helpful. And we will see you again next Thursday for our next episode. Thanks guys, take care.